Hi, everyone. Welcome back to the Balanced Boss Mom podcast. I'm your host, Erika, and today we're having a wonderful and powerful conversation with my friend Annie. She is an associate marriage family therapist based in California. Again, this podcast is empowering ambition moms to balance personal, professional, and parenting life. Welcome, Annie.
Thank you. Happy to be here.
I am happy for you to be here. Of course, today is Tuesday. I am so happy today is Tuesday because we only have a couple more days till Friday. So I know you busy. I've been busy. So I want to get into this powerful conversation. I do want to let you know that there is a trigger warning because we are discussing emotional raw conversation in reference to birth trauma, postpartum mental health, and identity shifts in motherhood. If you are currently pregnant or you have been dealing with like infertility or are in an emotional space, I want you guys to take note to pause this recording if you need to and come back to it to a later date. But I want to dive in and introduce Annie because she is a powerhouse and she is really awesome. So Annie, welcome again. And let's dive into you a little bit.
Yeah, thanks. I'm so happy to be here and excited to talk about all things perinatal mental health.
I'm so excited because I was referred to you by Dr. E, and she was explaining about the diving into the healing after birth to cesareans. And she's also referred me to Dr. Balance, which I will be discussing later on this week in reference to healing about afterbirth. So I'm getting both sides of everything. So can you explain a little bit about what your profession is first and foremost? What is it's periodontal mental health? Am I saying that correctly?
Perinatal mental health.
Perinatal. Okay, y'all say it with me. Perinatal mental health. Just want to make sure I said it correctly.
Yeah.
I'm glad
Yes.
you're here. That's why I'm stumbling over here because it's Friday. But yes, talk to me a little bit about that.
Yeah. So like you mentioned, I'm an associate marriage and family therapist in California. And perinatal mental health is kind of all things pregnancy, birth, postpartum related to, your mental health during that stage of life. So I work with mothers during pregnancy and postpartum. I do individual therapy, psychotherapy. And I also run a birth story integration group online to kind of help moms who maybe need some extra support after they give birth and maybe need some extra support in kind of processing and integrating their birth experiences.
Now that is awesome. Now I wish I would have found you a lot sooner. Just like I was telling Dr. E, the traumatic experience that I had with my birth it still traumatized me.
A lot of people say that. And I
Horrible.
wish I wished I had someone like me too, which is part of why I decided to become me. I was already doing some perinatal clinical training as part of my graduate school program. I did my clinical training at the infant parent program in San Francisco, at San Francisco General Hospital. Was there when I got pregnant with my first child. And so that experience of being a trainee in this field while also going through my own pregnancy and then complicated birth experience
Mhm.
really made me committed to doing this work with moms in the long term. So
So that was calling as
yeah, I didn't know it, but it became that. And now I have two babies. I had two totally different birth experiences. Second, actually my son turns 1 tomorrow. So I'm
oh,
like all in my feels about it. Yeah, he turns 1 tomorrow and his birth was incredible and so empowering and just a complete 180 from the difficult experience that I had the first time. And I really think that's because I did a lot of my own healing after my first traumatic birth experience that allowed me then to make really different choices the second time around and have a totally different experience. So, there's so much shame and silence and like self blame and doubt that gets put onto moms when our birth goes the wrong way. Or even if it doesn't, I feel like a lot of moms maybe don't feel entitled to pain or suffering after birth if, like, technically things went okay. But birth is like the most intense experience you can ever have. Like men could never. And we don't talk about it
we
enough.
don't talk about it. And that's why I say this conversation really does matter. All the conversations that I've had on my podcast have been really matter. But of course, from with my situation, and I can explain it a little bit here, is it was so traumatic to have a fourth degree tear because I
Mhm.
didn't know what a fourth degree tear was going to be like. And as I explained to Dr. E, that I had sheets upon sheets, and they gave me one epidural was like this size, and then they gave me another epidural that was this big, and then they had to reverse everything for me, was very, very scary.
Yep.
And so, like you stated, it's so much shame around births because we often feel like, okay, well, we had this birth plan from the start, this is how this was supposed to go, and we're end up in an emergency situation where we have to pick. And that's pretty much how I felt. Like after I gave birth, I was like, I could have literally, I literally told my mom, I was like, if something happens to me, just take the child. I don't even care anything else. I don't even care. You can fight with the spouse, you can fight with the mother, I don't even care, but you're my mother. And so everybody was trying to make a decision for me and letting me know, hey, you need to decide on either pushing or doing. I said, I'm not, first of all, I'm doped up. I don't even, I'm not here. Like, what am I supposed to do? And I think your profession is a really important profession to speak on because it does an enlightenment on moms across the world on what they need to do and how they shouldn't feel ashamed about it.
Yeah, there's such a wide range of ways that you can experience birth. And there's no like one way that's like, oh, that's traumatic. Like it just all depends on how you feel and how you perceive it and how you experience it. And I, I would say the most common thread is that makes women feel like their birth was traumatic is this sense of feeling like powerless or confused or like they don't have agency to decide what's going to happen to them.
Mm-hmm.
Part of what I do in my work with the integrating birth group is like help moms reframe that and regain a sense of feeling like power and control over yourself and your body and your story.
And I do believe that because your story is just beginning, it's not ending, is what I like to say for myself.
Mhm.
The other thing I would say is after I did have birth with my daughter, I felt, I don't want to say alone, so to speak, but I did go through a postpartum period because I had to learn, again, like I stated in my previous episode with Dr. E, I had to learn how to rewalk. And that was the toughest thing, to just feel like you can't feed your child and you got to learn how to retake a shower and rewalk again, and just have this, you go into a postpartum depression. And not often a lot of moms talk about postpartum depression or postpartum anxiety. And I want to be the voice to sit there and say, if you are going through, whether you're a mom or not a mom, and you're going through postpartum or postpartum anxiety, that it is okay to go through these things and it's just a season that you're going through. And one of the things I do want to talk about that is important in our conversation here is the lack of support for moms with traumatic births.
Yeah, it's crazy. It's sort of like, you often hear like, oh, well, your baby, a healthy baby is all that matters. And I just totally disagree. Like, of course, that matters a lot. Like, yes, that matters. And of course, we can be thankful that our baby is healthy and we're healthy eventually.
Mm-hmm.
Birth is a trans transformative experience, a like spiritual, emotional, physical, complete transformation.
Mm-hmm.
It's like, in a lot of indigenous cultures, people go on, it's often men go on vision quests, right? Where they like go, they sit at the top of a mountain by themselves. They don't eat or drink anything for days. They like go totally to like communicate with spirits and like receive this vision for what their life should be. And I think for mothers, that's what birth is. We go to like another planet. We are totally like, our whole body completely, literally tears apart. We go to another planet and then we come back and it's like it never happened. Like you get discharged from the hospital and they're like, good luck. At least you have a healthy baby.
Yeah, and that was something that I found interesting with Dr. E because when we were discussing our conversation and she was letting me know about how really you should have 2 weeks to check in after having the child to see if you're even mentally okay instead of waiting 6 weeks, and how other countries like UK or overseas don't even have, or they have the benefit of, we're going to take care of the mom first and then we'll worry about the baby. I thought that was such a mind-blowing experience because it was so weird. I was on TikTok and I was looking at this influencer, and she has had births in 3 different countries. She's had one in the United States. I do believe she had one in Costa Rica, and then she had
Mhm.
the one in Dubai. And she was talking about a little briefly how each country was different. And
Mm.
why don't we have this type of support system in the United States where you take care of the mom first? They're worried more so about a bill than taking care of the mom. And I think we need to normalize having support systems more often for moms that are going through all of this because it's not fair.
No, and moms literally make the world go round.
Hmm.
Yeah, I mean, it's just so backwards. It's just so backwards how much our society puts a value on our productivity and getting back to the workplace and bouncing back and just like sewing you up and sending you on your way. There's not enough value placed on the inner experience of birth and postpartum, which is so vulnerable and so tender. I mean, as you know, you're like bleeding, leaking, crying, sweating, like trying to figure out how to feed this baby. You're trying to figure out who you are, who you were before. You're not the person you were before. All of a sudden, you have this whole new identity.
Hmm.
It's this matrescence is the term that's used. That term was coined by an anthropologist named Dana Raphael, but kind of became popular pretty recently by a psychologist named Alexander Sachs. But she talks about matrescence being like the same as adolescence, where you
Hmm.
go through hormonal changes. All of a sudden, you have weird hormones that weren't there
Yeah.
before. You go through physical changes, right? When you become an adolescent, your body changes. When you become a mother, your body changes. You go through complete like identity shifts where you're going in adolescence, you're going from being a child to an adult. And
Yeah.
in adolescence, you're going from being a single person just living their life to being a mother. It's like
Yeah.
a total transformation. But people don't talk about matrescence. Like, I bet you've never
More.
heard that word before, if
I
you
need
know.
give me more of this because I need this in my life because it's almost like it's day and night. Just like how you said, you're going from being, it's kind of like Sex in the City if you think about it. You're being like Carrie and you're single, and then you turn into Miranda, and all of a sudden you're married and you have kids, and you're like, what? And I'm sorry for you, the Sex in the City reference, guys, but it's my favorite show. If they hear this, sponsor me, please. Anyways, so it's like a day and night shift because it's like, I get it, what you're saying, because that's is something, one of the things I did experience after having my daughter in 2018 is where I was like, who am I? Who is Erika before? Erika would have go out to eat and she has all these things done and all her checklist is done. And then once I had my daughter, I was like, oh, I can't go out anymore and be like I'm supposed to be anymore. Or it was just little things I would like, my boxers are not like, it was her time, not my time.
Mhm.
And fast forward now, she's a lovely 7-year old and she's in the second grade, the love of my life. She's
Mhm.
teaching me each stage in life the different lessons. Like you stated, it's like an atlas of going from being a mom and, I mean, not being a mom, being single to being a mom. It's that transition, just like how you're going from being a toddler to going into a teenage stage. So that's kind of like, I can see the comparisons because
Mhm.
that's what I'm experiencing now with my daughter. Is now she's turning into this little preteen little child of mine, and I'm like, I'm not ready. I'm not ready at all. It's I need a book. Can we get a book? I need.
Yeah. Yeah. I mean, just throughout our whole lives, there's so many transitions like that, but I just don't think that this one is talked about enough. And so much of what I work on with clients that I see is the grief that comes from having to say goodbye to your old self over and over and over again, like constantly. It's just a million moments of grief and letting go and letting go and letting go. And that's hard. But nobody talks about that sort of dark side of it. It's all just like, oh, congratulations and your baby and you look great and you're bouncing back and you're, whatever, but there's not enough space made for the messy, ugly, sad, hard parts. And that's why I think perinatal mental health challenges come up so much. That's often like postpartum depression, postpartum anxiety comes from trying to mother alone, which
Mm-hmm.
we're not designed to do.
Mm-hmm.
You're not supposed to be all by yourself all day long with your baby with no support and no one to talk about the hard parts with. And
Or that
that's
friend that you don't even, the friends that you used to have, you had those friends that are single, and then it's kind of like how you, when you growing up and as a little girl, you have that vision of, oh, I'm supposed to have the white picket fence and I'm supposed to be the bride and I'm supposed to, it's like a timeline. And
hmm
it's like your identity shift. It shifts
hmm
mentally, but it shifts physically. And you're trying to balance both those, and you can't really balance. You have to pick one. It's kind of like you have to pick, okay, do I focus on the postpartum depression right now? Or do I focus on my child? Of course, I'm going to focus on my child first because she comes first.
hmm
But then it's like, all right, I'm stuck in this. I had postpartum depression. I want to say I couldn't walk. I had her in January, couldn't walk February. My birthday, I couldn't walk. I think I want to say about the end of May. By the end of May of that year, I was like, I got to get up. I can't keep doing this. I have to try to walk. Because when the nurse made it realistic for me, when she said, you're going to be by yourself. You're going to have to get up. You're going to be by yourself. And I was like, excuse me? Like, you just said that. First of all, I just ripped, okay? I had a midwife that didn't really know what she was doing. She was playing a violin, okay, on me. And it was not, yeah. I was like, so for you to, I'm taking a part, like, for you to say that, and that's another thing that we don't touch on in the hospitals is having good bedside manners. It's like when a woman is going through what she's going through, the last thing you don't want to think the last thing she wants to go through is you telling her what she should be doing.
hmm
That's not cool. So I think that we need to normalize the identity shifts, but we also need to understand the difference. And I want to understand a little bit more the difference between like the baby blues and the postpartum depression. When you have that postpartum depression, I know sometimes I still get in seasons of it every now and then. But when you recognize those seasons, what exactly are you supposed to do in that season?
Yeah, well, I think you brought up a really important point, which is the difference between postpartum depression and the baby blues. Because I think a lot of times postpartum mood and anxiety disorders can get written off as the baby blues when it's more than that, and you might need more support. So the baby blues happens to, I think it's like 80% of new moms. Like everybody gets the baby blues. Usually it starts around 2 or 3 days postpartum. It's a majorly hormonal thing. That's when your milk comes in, your hormones are like on a magic carpet ride, like completely crazy. And so you
I,
feel
I felt
overwhelmed. Yeah, you might feel really like weepy, crying, just like anxious. You might have trouble sleeping, kind of all those things. But the big difference is that it's temporary. Like that should go away within a couple of weeks. If you still are feeling this way after like 2 or 3 weeks,
mm-hmm.
that's something different. Then, if you're feeling sad, kind of like empty, kind of numb, like you're not excited about doing things you used to do. You don't feel connected to your baby. You're having trouble with appetite or your sleep or just feeling kind of like really anxious, like you're constantly checking on the baby monitor. You're constantly making sure your baby's breathing. Those kinds of things that continue more than 2 weeks.
Mm-hmm. Mm-hmm.
That's when we really want to kind of look and see like, is this,
Is this
this,
something else?
yeah.
Because I think what happened was the realization that happened for me is I think I did my 6 week checkup.
hmm
And when I did the 6 week checkup, I was kind of like blank.
hmm
And so the doctor was like, "Hey, Erica, you okay?" And I was like,
No.
"No, not really. No, I'm."
Yeah.
And she was like, "Well, tell me how you've been feeling. Let's just talk. Tell me how you feeling." And I was like, "You're not gonna write this on me, are you?" Because that's the first thing. I was like, "You're not gonna write this on me." And she was like, "No,
Yeah.
I just want to talk." And
Yeah.
so, like, I've been sleep deprived. I'm tired. I'm hungry. I was like, my plate is sitting next to me where I get these beautiful meals. I eat and then I'm exhausted. And I said, I'm snappy. I said, I'm very, very snappy. And I don't know why I'm so snappy because I would snap at my spouse and he'd be like, I'm just trying to take the load. Like, I was like, I don't want nobody touching my daughter. I was just so like up and down.
Mhm. Mhm.
And that's when she introduced, she said, Erica, you might be going through a little bit of depression and it could be postpartum. I said, no, not me. No, no, not. And she said, Erica, it's a reality check. It's okay.
Mhm.
And the moment she said that, and my spouse's mom took me and she knew I was snappy. The moment the doctor said that, I just cried,
Mhm. Yeah.
started crying. And
Yeah.
I don't know what's wrong with me. I said, it's my hormones. What do I do? And it was because I wasn't walking. I wasn't going outside. I would sleep and I'm sleeping for hours or I'm just eating and I'm not eating. It was just so much up and down. And so it's like as moms, we have this little language where we take this on silently and not speak on it enough because we feel like somebody's going to report it or we feel like we don't have that that best friend that we had, she don't understand what you're mentally going through. So when you're trying to explain it to your best friend and your best friend's like, girl, you crazy. And it's not that you're crazy, it's just you have those hormones. And it's like we need to start unpacking the birth traumas with the C-sections and the unplanned outcomes of all that. And I want to talk about that because I feel like trauma can come in so many different forms. It can come in the form of being fearful, it could be a form of silence, grief, and we don't talk about that. We don't, I think what it is when I'll say, let's say, for example, social media, when it first started, a lot of people weren't getting on social media, for example. I'm trying to make an analogy here. But when social media first started happening, not many people were getting on that. And so now social media is so big, everybody now don't want to be on that. And so I feel like with moms and the trauma is there's like you're just supposed to go to work, cook, clean, make sure the husband is taken care of. But I feel like it needs to be reversed. It needs to be reciprocated. So I want to talk about that trauma in reference to that detachment and that fear.
Hmm. Yeah, I mean, like you said, it can look so many different ways. It can look so many different ways, and there's no definition of like this experience is traumatic and this one's not. It's all dependent on how the person is experiencing it feels. So, trauma is when your nervous system's ability to cope is overwhelmed. Like whatever is happening is more than you can cope with. And I would say like even in the best of circumstances, birth probably fits that bill. Like it's so
Yeah.
intense. It is so physically intense, even if everything goes like perfectly.
Mm-hmm.
So the chances that I think I can't remember the exact statistic, but I want to say something like 45% of new moms experience their birth as traumatic because it's overwhelming. It's so overwhelming. And then you take into account the ways that women often feel disempowered by their providers or like they don't have the ability to decide or choose what's happening. Or then you take into account, the confusion and like you said bedside manner, like the ways providers talk to moms and allow them to make choices for their own birth experiences or the interventions that come up or the rushing moms through birth.
Mm-hmm.
All of those things can end up
Can I
in it being traumatic.
can I throw another trauma on you? How about when you go to the hospital and your doctor doesn't even show up for you?
I mean, exactly. Like so many
Yeah,
people give birth surrounded by people they've never met before.
I was
Like,
wondering.
yeah, you don't want to, like, I forget who was explaining it. I think the midwives that I had my second time around were like, you giving birth is kind of like pooping. It's like a private event where you're like kind of got to like do your own thing. And you're not, if you put me on a table with a flashlight and are like, okay, and then a bunch of people that I've never seen before, and you're like, okay, poop, your body's not gonna, like, no. And giving birth, your body has to open and soften and relax so much that it's never going to happen the way it's supposed to when you're like feeling overwhelmed and afraid.
It's not because pooping is very sacred. I want to say that, ladies. It is very sacred. And sometimes you just need that sacred moment because when I had those two big lights, let me tell you, my best friends were literally, when I say it was a circus from the moment I got there to the moment I left, My best friends were outside of the door. You got it, Erica. Just push it, sister. And they was like, she's fake pushing. Push it, sister.
Oh
I'm
my
not
God.
fake pushing it, everybody. It's hot. I'm sweating. I said, and by the way, I am doped up, so leave me alone. It was a like the nurse came in and she said, ma'am, I'm not gonna say I love you dearly. She said, but I'm gonna be your mama today. She said, let me your ear. She said, do you want all these people to come out this room? I said, I don't know what I should do, but I'm terrified right now. She said, 1 second, please. She said, if you're not the mother's spouse, or the spouse, get out. She said, because this is a circus, and y'all not about to drive her. She said, you see her blood elevation? She's going crazy. Get out. When I say,
God bless that nurse, though. Like, thank God you had someone like that to hold it down for you.
yeah, because my mom and I was like, I'm worried about so many avenues. I'm like, my mom and my spouse's mom not getting along. My spouse is playing the video game, which I'm not understanding.
Oh, no.
Mine was everywhere. And then the whole epidural and the provider flirting with me and was like, yeah, you got to come back here because, I have scoliosis in my back. And he was like, yeah, he's trying to make me laugh. And so I'm worried about my spouse not knocking out the provider because he's flirting with it. When I say, if people knew what this experience was like for me, they was like, do you want any more kids? No. I said, because this was a circus. This was insane for me. So
Mhm.
I know when we were talking about the at least, your baby's healthy, you got 10 toes, 10 fingers. There's a lot of misconceptions around that, about dissing the mother's birth plan. And I feel like the whole 10 toes and 10 fingers thing, I feel like it's dismissive to the mom. Would you agree with that?
Yes. Yeah. It's like the most, it's one of the biggest, most important days of your life. And just because it ended doesn't mean it was all fine.
That,
I
yeah.
think
She cut
it,
straight.
just because you got through it doesn't mean that it was okay. Doesn't mean that you have to feel fine.
Mhm.
I think every mom deserves the space to let the way that it went integrate.
I like that you said that because, like I stated, there's so many misconceptions around that sentence and around what birth trauma looks like. And even that, I don't think a birth story is unfinished because it's just the beginning of your child's story. It's like saying, hey, she's here and she's here for a lifetime. She's not walking away. And I just don't like when the moms feel like it's just unfinished for them, because it's not unfinished for them. It really isn't. It's just the beginning of that. So I want to talk a little bit about that, a little bit unpacking that a little bit more, because we deserve to continue our story.
Yeah. And if a lot of times, if you find yourself coming back to the way your birth went over and over and over again, like you can't get it out of your head, you're like kind of having, I don't want to say flashbacks, but like remembering parts of it over and over, or you just, when you think back on it, you feel mad or you feel frustrated or you feel ashamed or you feel like something's wrong with me, my body couldn't do it. Like, I wish I could have done it. Like, those are all signs to me that maybe there's some work to be done to support you to make sense of the way that your birth went a little bit more.
You're going to have me speechless. I feel sometimes like I feel like every time her birthday comes around, I'm
Mm,
this is reminding me of what I've experienced. And then, after that, you get the question of, hey, do you want to have more kids? And I'm like, not with what I experienced. And I know that there's healing that needs to begin with that if I ever do want more kids, because
mhm.
that will pass down on the next set of kids, or, just anything in life that will happen. The healing does need to start. So I do want to talk about what are your healing practices and your birth stories, like some of the tools healing after birth that you see.
Yeah. Yeah. Well, I think one thing that can be really powerful and that is a part of the groups that I am running is writing out your birth story. Not with judgment, not to try to fix it, but just to sort of witness the whole story from start to finish. That is in itself is really powerful. is a really powerful way to start to integrate it.
Hmm.
I think, somatic practices like breath work, like different types of therapy that allow you to kind of get into your body and notice like the feelings that come up in your body when you think about your birth and when you remember your birth
Hmm.
are all really important. Gentle movement like yoga, massage, all those things can help you reconnect with your body and release some of that trauma. Your nervous system needs to, reconnect and feel safe. And then therapy. I'm obviously biased because I'm a therapist, but trauma informed modalities like EMDR, I'm trained in EMDR, which is eye movement desensitization and reprocessing. Reprocess.
Not gonna cut you off, but I want to know so much more about the EMDR. Dr. E was telling me about that, and she was like, Erica, I think you may need to try to do that just to like get that experience and try to feel what you need to feel. And then she's like, you probably, after doing that, you're gonna feel a whole lot better. And
It's pretty amazing. Yeah.
I've been seeing people do that a lot more, and I do want to try that.
Yeah, yeah. But there's lots of different modalities of therapy that can be really supportive. And then I particularly think sharing your birth story in a group, in a circle of women who are there to also hold it and witness it with you is so powerful. Not just to retell the whole story, but
Hmm.
like in my group, we kind of weave in different therapy modalities, different pieces from like narrative therapy, EMDR, storytelling, somatic work, cognitive reframing, helping yourself not just like retell the story, but make sense
Of what you're feeling in totality. So
yeah.
like that you stated that. I do want to shift a little bit into talking a little bit more about the specific challenges, and I know this is probably going to steer some people that I'm talking about this, but it has to be talked about. So, I want to talk about the challenges for Black and Brown moms accessing safe and empathetic care. And I do apologize to anybody if this offends anybody, but it has to be talked about because I noticed that more Black women are dying more in the healthcare, especially now more than ever. And we also need to normalize breaking generational curses. That's one of the things that I am working on with my daughter is if there's something that I dealt with as a child, she doesn't need to experience in her childhood. And so
Mhm.
I want to talk about the culture and the strength of mental health around black and brown moms. I really do because it touches me not only as an African American woman myself,
Mhm.
but I want to open the eyes of my friends that aren't African American, that are Hispanic. I have friends that are white, and I do want to get them to see in my eyes what I dealt with as an African American in the healthcare space.
Yeah. This is such an important conversation and something that I feel so strongly about because you're exactly right. In the United States, Black women are 3 times more likely to die from pregnancy related causes than white women. And that's even when controlling for things like education or income levels. And that's not about individuals, that is about systemic racism in the medical institution. Full stop. That's what it is, and it's unbelievable. It's way more common for birth trauma and poor outcomes to happen to Black and Indigenous women of color, mothers who are birthing, because systemically they're less likely to be listened to be believed, to be heard, and to be respected for the experiences that they're having or their preferences. And so I think, taking an anti racist stance as a therapist means naming that harm, like
Thank
straight
you.
up talking about it and
Appreciate
advocating for
for
that
that.
change.
I would. You're gonna make me cry because oh dear, not gonna cry, but I am gonna cry.
I'm a therapist, so lots of people cry around me.
Oh, I'm
You,
trying.
you,
All right. And I'm sorry if I cry, but a lot of people don't understand. They don't. Woo-hoo. They don't understand when a Black woman has to face a lot of different things that most people don't have to face, especially in the medical field. A
yep.
lot of people don't. Try not to cry on you. Sorry, guys. But the fact that if I didn't have my mom or my mom's spouse or my spouse to advocate for me, I think I probably would have died. And my daughter wouldn't be here.
Mm-hmm.
I was very upset in reference to when my water had broken. I went to the hospital and I was calling my doctor repeatedly. And I was like, why is she not answering the phone? Why is she not answering the phone? Why is she not answering? I called repeatedly, like, where's my doctor? And for the fact that you rather go on vacation, mind you rather go on vacation to sit there, not answer the phone of your patient as she's leaking, to tell her, hey, it's okay. Hey, I'm not gonna be there, but I'm gonna send somebody else there. That would have reassured safety for me overall. And the access to safety and the access to bedside manners is insane, that I could even fast forward to after I gave birth to my daughter. And I went to an OB. No, this was after I gave birth to my daughter. I got pregnant again. Got pregnant again. And I was so excited. I was like, oh my God, my daughter's going to have a little sister or brother. And come to find out, I ended up having a miscarriage during around the time August, September.
Mm-hmm.
And when I went to go to the hospital, I already knew, of course, but I ended up getting this, a different doctor, this guy. I was like, okay, maybe men are going to be a little bit more respectful, a little bit more. What was I thinking? Ding, ding. So he would call me, he would be like, you're the same age as my daughter. He was like, I'm going to talk to you as if you were my daughter. This is how he was. I was like, okay, I didn't think nothing weird of it. Cool. Fast forward, I go to the doctor's office to get an he was my OBGYN. Go to the doctor's office. And he told me when I got out the hospital that they were going to do an ultrasound to make sure everything was cleared. I get to the doctor's office and the doctor was like, oh, we're not doing an ultrasound. I said, what? I said, I said, the doctor told me when I got out the hospital the next day, come here. We're going to see if everything got cleared, just in case I have to do a DNC or anything like that. Mm-hmm. So by that time, I guess I didn't need they checked, I did need a DNC. Everything, I guess, dissolved itself. And they were trying to force me to get on birth control. And I was like, well, how I got pregnant with my daughter was I was on birth control. I was on the pill and I feel more comfortable getting on the pill. Can we recommend that? No, I don't think you need that. I said, but why not? And he was like, you don't need that. We're going to do the IUD. I said, no, I don't feel comfortable with doing the IUD because I've had some of my family members go through this experience and ended up having to get surgery and get organs removed and stuff like that. I don't feel comfortable. Well, you need the IUD so you don't get pregnant. I said, well, I want the pill. So we're arguing at this point back and forth.
As if he has any right to make that decision for you.
Oh, it gets better. The nurse practitioner comes in and I never returned back again. I never returned back again after that. The nurse practitioner basically told me, oh, you continue to have babies, you're gonna die. You see your face. You just say, yeah, 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 yeah. I talked about it with Dr. E a little bit, but yeah, she was like, you're gonna die. When I say I signed the form because they kept pushing me about it. All I remember, I signed the form, I threw it on the desk, I walked out of there crying. And the first person I called my spouse's mom, and I was like, hey, I can't do this. I'm literally crying on the phone. I was like, I can't do this. I'm just hysterical. She said, what's wrong? And I explained to her. She said, no, you're not going back there. And the next thing, they kept calling me. I didn't answer the phone. I was still like in disbelief of, you as a nurse practitioner telling me I'm going to die if I keep having more babies. I was just like, is this real? Like, is this really happening? And I see that it does happen with Black and brown moms where they just get dismissed instead of being heard. But we need to realize there needs to be an importance of a safe space and to be safe.
Yep.
I just wanted to share that with you because I'm trying not to cry. And it's a challenge that I realize a lot of people face. And it needs to be talked about. I'm sorry if people get mad at me and don't want to hear this conversation, but I'd rather open up doors for people to come to me and say, you have talked about this and continue to talk about it. And if people don't like it, then I'm sorry. I really am. But my podcast is a safe space, but I have to bring it up. I have to bring the awareness because it's not just in the medical field that this is happening. This is happening in all over the different ranges of what we go through. So I appreciate you. I really do, for advocating for Black and brown moms. I really do.
Yeah. I mean, it's very important to me. And I think especially as a white presenting person who wants to be an ally, I think, and especially someone working in not healthcare, but kind of, in the system. I think that it's my job to support and advocate Black and brown moms. And so much of that comes from believing them and listening to them. Like the number one thing that I feel like I listen for when I'm working with a mom for the first time is like, if you say, I just don't feel like myself, I'm like, done. You're in. Like, let's talk. That's like, to me, the most important symptom, you know?
It is the most important symptom because, like, if a mom or just anybody in general can come to you and say, "I feel broken and I'm not worthy of healing," or even having that space to even grieve or just grow at the same time in all of this, it's not fair. It's not fair. And do you have any healing affirmations for moms?
Gosh.
Give me one. Give me one so I can just fight back these providers, okay? Because I need one.
Yeah. I mean, you talked about feeling broken. Like, you're not broken. You are allowed to grieve and struggle and still grow at the same time. And I think postpartum depression looks so different than what we think of as depression because moms are amazing. It's not like you're not in bed all day, unable to get up. Like you're still up, you're still with the baby, you're still waking up at night, you're still feeding the baby, you're still taking care of things.
Mm-hmm.
Moms are so much stronger
Moms
than
are superheroes.
literally anyone else, literally than anyone else. It's
We
unbelievable.
I mean, dads are superheroes too.
Yes,
But
for sure.
mom,
But they never.
they could never.
Shout out to all the amazing dads. My
Oh,
husband is one of them, but I'm sorry. If men had to get their genitals stitched up in order to meet their children, we would have paid leave for everyone. We would.
but that's a different topic that we need to take privately for another day because men couldn't do it. I'd be like, do you even know what a cramp feels like? Do you even know what a period is?
No,
Like,
no. They
no,
could never.
they could never. Well, I want to thank you for being on this podcast with me, and you've healed me in more than one way. Can you tell us where we can connect with you online?
Yeah. Yes. If you are in California and you're interested in one of the groups, please reach out. You can find me on Instagram. My Instagram is, what's the word for the little like is it underscore?
I think it's, yeah.
You know,
You
underneath
have
dash
it. No, we can keep it in. Yes, I think is it
at Annie underscore Dreese
yep.
underscore therapy. That's where you can find me. If you're outside of the state, Postpartum Support International is an amazing resource for finding support groups, care if you need it, if you're not in California. But yeah, I'm everything, like I mentioned, everything that I have been sharing today is based on my own personal experience, my clinical training for educational purposes. If you are struggling, I would just encourage people to reach out to a licensed therapist or provider close to where you are. And if you're looking for groups, Postpartum Support International, like I said, is a great resource, but find me on Insta.
Yeah, y'all find my girl on Insta, okay? I want to leave you guys with a final thought. You are not alone in this. You are not broken, and you are worth of so much healing. Whether you're a mom or not, the healing starts small. I would say that. It would start small, and it is possible that if either you're going through a postpartum depression, you will end up on the other side of the rainbow. Even if you have postpartum anxiety, you'll still end up on the other side of the rainbow. Well,
Mhm.
Annie, I want to thank you for being on the Balanced Boss Mom podcast. Until next time, I want you guys to keep grounded, stay safe. And if you have any questions, feel free to DM me at the Balanced Boss Mom Officials. That is my Instagram. Like, comment, and subscribe on my YouTube. I need y'all to start getting on my YouTube, honey, because I need the coin. Okay, I'm just kidding. I don't need the coins. I just need the subscribers. Anywho, she's laughing at me. She's telling me wrap it up. All right. Bye, guys.